Do you ever wake up first thing in the morning, before your eyes are fully open, and feel like your mouth has turned into the desert? Your tongue feels thick and glued to the roof of your mouth. No moisture at all, nothing to swallow comfortably. If that's happening to you more mornings than not, especially if you're over 60, please stay right here with me. Because what many call just part of getting older or brush off as a small irritation is often far more serious. My name is Dr. J. Smith, board-certified physician dedicated to helping adults over 50 age with strength, independence, and real joy in these golden years. In my years caring for seniors just like you, I've seen this one quiet symptom, chronic dry mouth, silently contribute to bigger health challenges that steal energy, mobility, and time with loved ones. Today, we're going to change that. Research from major geriatric studies shows that persistent dry mouth, known medically as xerostomia, affects roughly 30% of adults over 65 and climbs higher after 70. And it's strongly linked to increased risks of respiratory infections, unintended weight loss, dental destruction, and even systemic issues that lead to hospital stays. But before we dive into the key warning signs your body may be sending, let me share a story that still motivates me every day I sit down to record these videos. Sharing comments, your age plus do you wake with dry mouth? Yes, no. Meet Evelyn. She was 74, a grandmother of 5 from a small town in Pennsylvania, the kind of woman who still gardened every spring and walked her dog twice a day to stay active. For over a year, she woke up with that awful sandpaper feeling in her mouth. She kept a glass of water by the bed just to get words out in the morning. But she told herself, "This is normal at my age." She didn't want to complain. Over those months, she started losing appetite for solid foods. Swallowing felt harder, especially breads or meats. She dropped weight gradually enough that her daughter said, "Mom, your dresses are hanging loose." Then came the recurring chest colds, 3 in 1 year. Each time treated with antibiotics, sent home, no one connecting the dots. Until one night she woke struggling to breathe, lips tinged blue, oxygen low, emergency room. Diagnosis, aspiration pneumonia. Bacteria from her unprotected dry mouth had been slipping into her lungs night after night during sleep. What happened? Saliva is your mouth's natural shield, full of enzymes and antibodies that neutralize harmful bacteria before they travel deeper. Without enough saliva, that defense weakens. Microscopic bits get inhaled while you sleep. Over time, it builds into serious infection. Evelyn spent over 2 weeks in the hospital, came home needing oxygen support for months, and lost much of her independence temporarily. The heartbreaking part, when her family reviewed her records, they discovered she'd been on several common medications for years: blood pressure medicine, an antidepressant, and an over-the-counter allergy pill, without anyone checking how they combined. 3 of them known to reduce saliva production dramatically when taken together. This wasn't inevitable aging. This was a preventable signal ignored too long. And Evelyn's experience isn't rare. Studies show up to 40% of those over 75 deal with significant dry mouth, often tied to medications, underlying conditions, or both. Today, I'm walking you through the 5 major reasons dry mouth becomes a serious concern in seniors. Then the 7 clear warning signals that mean it's time to act quickly. And finally, 7 practical, evidence-based steps you can start this week to protect yourself. First, saliva does much more than help you chew. It's a powerhouse fluid with hundreds of protective proteins, enzymes, and immune factors. It starts digestion, keeps your throat lined and safe, fights infection right at the source. When saliva drops, a major 2020s analysis found seniors face nearly 3 times the hospitalization risk for breathing-related problems in the following couple of years. Second, medications are the #1 culprit for most of us. Hundreds list dry mouth as a side effect. Think certain blood pressure meds, antidepressants, allergy remedies, water pills, even some bladder or sleep aids. When you're on multiple, polypharmacy is common after 65. The drying effects don't just add up, they multiply. Research in dental and geriatric journals confirms that combining several saliva-suppressing drugs can intensify the problem far beyond what one alone would do. Third, dry mouth quietly leads to poor nutrition, even if you're eating regular meals. Saliva kickstarts carbohydrate breakdown and signals your stomach to produce the right acids. Without it, food isn't absorbed as well. Mayo Clinic studies have shown nearly half of seniors with unexplained weight loss or malnutrition had untreated dry mouth playing a hidden role. You can sit down to 3 meals a day and still slowly become undernourished. Fourth, without saliva's balancing power, harmful mouth bacteria grow unchecked. This imbalance allows dangerous strains to thrive, enter tiny breaks in gums, and travel through the bloodstream, linked in research to worsened heart inflammation, poorer diabetes control, faster cognitive changes, and higher infection risk overall. Fifth, chronic dry mouth is rarely isolated. It's often your body's alert to something deeper, an undiagnosed or unmanaged condition waiting for attention. Now, here are the 7 warning signals that your dry mouth may be pointing to something more urgent. Pay close attention. These are the ones doctors sometimes miss unless you bring them up. Before I list them, let me ask, how many medications or supplements are you taking right now? Drop the number in the comments, because the next quick story ties directly to that. James was 69, a former mechanic who loved tinkering in his garage and playing catch with his grandkids. He ignored morning dry mouth for nearly 2 years. Then came rapid tooth sensitivity and pain. His dentist found aggressive decay and sky-high levels of decay-causing bacteria, levels usually seen only in extreme cases. Tests showed his combination of a diuretic for blood pressure and an acid reflux med had severely suppressed saliva. That bacterial overgrowth was already inflaming his arteries subtly. A heart check caught early changes. Adjustments were made, dry mouth treated aggressively. He's back in the garage today, but it was close. Here are the 7 signals. Persistent bad breath that smells ammonia-like or unusually chemical in the morning, alongside dry mouth. This can signal kidney strain. Ask for kidney function tests. Saliva that's thick, stringy, or foamy instead of thin and watery. This often points to autoimmune issues like Sjogren's syndrome or rheumatoid arthritis. Request appropriate screening. Dry mouth that's mainly severe at night or upon waking, while daytime feels okay. Classic sign of sleep apnea causing mouth breathing. Consider a sleep evaluation. Dry mouth combined with getting up multiple times at night to urinate. This duo raises a strong flag for uncontrolled blood sugar or diabetes. Get fasting glucose and HbA1c checked promptly. Dry mouth plus persistently gritty, burning, or dry-feeling eyes. This is a hallmark of Sjogren's syndrome, which affects many women over 60 and is frequently underdiagnosed. Early treatment matters. Dry mouth together with muscle cramps in legs or feet, especially if on water pills. Signals electrolyte shifts, low potassium, magnesium, sodium, that can affect heart rhythm. Urgent doctor visit needed. Dry mouth that began or worsened within the last 3 months after starting a new prescription. Your body is saying, review this, push for a full medication interaction check. So what can you do starting today? Here are 7 straightforward steps drawn from clinical best practices for seniors. Step 1. Start a simple morning mouth check. Before your first sip of anything, take 30-60 seconds. Is there any saliva, thin or sticky? Any odd odor? Can you swallow easily? Track it daily. It gives your doctor real data. Step 2. Do a medication review. List every pill, prescription, or over-the-counter. Look for labels mentioning dry mouth or xerostomia. Then ask your doctor or pharmacist, I'd like a comprehensive review of my anticholinergic burden and combined drying effects. Those exact words open the right discussion. Step 3. Rethink hydration. Plain water alone isn't enough. Salivary glands need electrolytes to work properly. Sip small amounts frequently. Pair with foods rich in potassium and magnesium, bananas, spinach, nuts, and consider electrolyte-balanced drinks if approved by your doctor. Step 4. Protect at night. Raise the head of your bed 6 inches. Use bed blocks, not just pillows. Use a cool mist humidifier set to 40–50% humidity. Before bed, try a gentle, alcohol-free, xylitol-based mouth rinse or spray designed for dry mouth. Step 5. Stimulate saliva naturally. Chew sugar-free gum with xylitol after meals. Suck on sugar-free sour candies to wake up glands. Include crunchy veggies, carrots, celery with meals. They encourage chewing and flow. Step 6. Prepare for your doctor visit. Use this script. I've had ongoing dry mouth affecting my eating, sleep, and comfort. I'd like to explore if my medications or an underlying condition are involved and discuss salivary function evaluation or adjustments. Clear, clinical language gets action. Step 7. Know the red flags that need immediate care. Difficulty breathing with dry mouth, right arrow ER now. White patches in mouth, right arrow doctor same day, possible thrush. Sudden confusion, weakness, chest pain, or irregular heartbeat, call 911. A quick note on common myths. It's just aging. No, significant dry mouth almost always has a treatable cause, often meds or conditions. More water fixes it. Not if glands aren't producing. It's a production issue, not just intake. And yes, if you have dentures, dry mouth still raises risks of sores, infections, and poor nutrition. This is for educational purposes only and is not a substitute for professional medical advice. Always consult your doctor or healthcare provider before making changes. Evelyn's story has a hopeful ending too. After her hospital stay, her family advocated fiercely. Meds were adjusted, one discontinued safely. Saliva stimulants and nighttime routines added. Within months, her dry mouth eased dramatically, weight stabilized, energy returned. Now she shares laminated cards with those 7 signals at her local senior group, hundreds handed out. She tells everyone, "I dismissed it. It nearly took me down. Don't wait like I did." If this resonates, if you're waking with dry mouth, type one word in the comments right now. EVI if you're taking this seriously today. MEDS if you're on multiple and will request a review. Doctor if you're bringing it up at your next visit. Share this video with one person over 60 you care about. It could make a real difference in their health and independence. If this helped you understand something important, please give it a thumbs up. Subscribe for weekly straightforward senior health guidance and hit the bell so you never miss an update. Bookmark this for those 7 signals whenever you need a reminder. Stay proactive about your health, stay vibrant, and stay blessed. I'll see you in the next video. Take care 5/8 fast.